All right, as we continue, Dr. George Fareed and Dr. Brian Tyson are with us. I've heard from more than a number of doctors that Regeneron in particular has been tremendously effective at helping people that have maybe had some of the more or most severe symptoms. Dramatic stories of turnaround, including Dr. Benjamin Carson. And we know it worked on President Trump. And I know other people that have had it as well. And have you found the same results? Dr. Tyson, I'll ask you first.
Yeah, so we use a combination, and this is where there's no outpatient treatment for COVID. I just can't believe it, because Regeneron is an outpatient treatment. We've given it to our high-risk patients, diabetes, morbid obesity, anyone over the age of 55. If you've got 2 or more comorbidities, you qualify for Regeneron. We send them to the hospital, they get their treatment, and then we also put them on our triple cocktail. And we've seen dramatic turns around in 2 to 3 days. People with oxygen saturations as low as 90% have turned around to 98% within 24 hours. It's being completely disregarded in replacement of these so-called vaccines. And what's interesting that we've seen in our clinic recently, and I can tell you that Dr. Peter McCullough has verified this as well, is the new cases. We're seeing more new cases of COVID post-vaccine than we are seeing people who have not been vaccinated getting COVID. What seems to be the issue is the COVID vaccine seems to drop the people's immune system, and during that 2 to 3 week period, they're being more susceptible to actually getting the infection. And those are the patients who are testing positive. We're seeing probably 40 to 50% of our COVID patients have already had either 1 or 2 doses of their vaccines.
Wow. I mean, it's just kind of, it's mind-numbing to me. Dr. Fareed, you want to add to that?
Well, yeah, I would just say that the monoclonal antibodies are a tremendous add-on to the outpatient therapy, as Brian has stated. The combination with the ivermectin HCQ oral treatments makes it a 100% success. But they're very underutilized. The government paid these companies, Lilly and Regeneron, $800 million or more, and they make the treatment available free. Patients pay for the infusion cost, but regardless, the 75% are not used around the country. So people I get contacted, they're not easily accessing it, and so they go on our protocol, and they do very well. But it's also a issue of the dispensing of this of these monoclonal antibodies, or the access that hasn't been set up really suitably, in my opinion.
But the fact that we have all of this with the track record that you both are describing, and there's very little discussion about it. I'm not saying people have to do it, but at least I can tell you from my own experience that when I hear people have it, and I mention these options that both of you have been using, it's they've never heard of it. Let me ask you one last question on the other side of this break. Right. If you can stay with us just a minute longer, and it's more about kids, and then we'll get to everybody's calls. 800-941-SEAN is our number if you want to be a part of the program. Oh, man, the tanking of the Oscars, the Academy Awards. It's unbelievable. We'll get to that. Joe Concha and Louis Gohmert, and your calls, 800-941-SEAN, as we continue.